what is wonderful, and as others have touched on, is the fact that this is a huge missing piece of the puzzle that Tom, thank goodness we all have met Tom, that how did we find out what disease our patients had? It was whether they bled. That was it. Yes, it was redness, it was et cetera, but it was whether they bled. And as like Jason, having used lasers, etc., and found, yes, I get wonderful results and things, but then this is a piece of the puzzle that we didn't even touch on previously, and it makes such a huge difference. And it's exactly what those of us who are involved in hygiene hackers and the Larkin protocol have loved about it, because not only does it give us that piece of the puzzle to treat people, but it also gives us the mechanism to inspire patients. It's not a matter of trying to cajole the patient. They're actually demanding treatment from you, and they want it now. You actually, in a sense, you're having to pull the reins in and say, well, sorry, I can't quite see you yet, as Kate and Sanjay are saying now, even more impossibly than we are in Melbourne, which I don't know what you're going to do about it, guys, except you better find another hygienist, Sanjay.
Maybe we can get all the American hygienists that don't want to work there anymore and have them come over and help us.
But having all these tools, that they are wonderful things to have, but this is the piece of the puzzle to make it all fit together. When we've got taking the sample, checking it out, patient all inspired, and then having the tools, whether it be the lasers, certainly the use of the ozone, mouth rinses, etc. We've got wonderful, wonderful tools that just change the whole dynamic of dental practice. And patients are just so inspired by us being able to do these things for them. It makes it so much easier to describe and involve the patient in their health. And as Tom has done all this work over so many years, pulling it together, and thank you once again, Tom, it is just inspiring in practice. I wish I was a younger dentist.